Now, there is a lack of curiosity about the deaths of marginalised people. Those are the words of Caroline Aldridge, whose eldest son, Tim, died in 2014. It was what the coroner called an unexplained death. Tim had bipolar disorder, and like so many others with mental illness, his GP had referred him to mental health services many months before he died, still waiting for that appointment. His mum, Caroline, is also a social worker, and after his death, she sought answers about why and how the system had failed her son. The result is a book that she's written, He Died Waiting. Well, Caroline joins me now. And Caroline, first of all, thank you so much for coming to talk about this today. I know it can't be an easy thing to do.
Thank you for having me. I couldn't have talked about it 6 years ago, 4 years ago. But yes, now it's been a journey, and I feel compelled to talk about it for all the other Tims. There are thousands of people like Tim.
Well, tell me a little bit about Tim, the person, not the patient.
Tim was quirky. He was always quirky, and he was highly intelligent, but sometimes his mind would race at 1,000 miles an hour, and he would talk endlessly about things like quantum physics, and he was always very chatty, and he was a champion hugger, and I think the whole family missed his kind of affectionate really, and his chattiness. And he was also very caring, so services, the way he was recorded in by professionals was all about his deficits, the things that he couldn't do that were wrong with him. But actually, after he died, I've sort of heard lots from friends and things to realise that within his friendship group, he was looked up to. He was the one that took care of other people, and things like he was dyslexic, but he would research the law and write letters for friends about their employment rights or things like that. So he was a kind of big character. He was very tall and imposing, and sometimes quite quirky, like wearing a top hat and things. But he was also just lovable and lovely and really valued by people.
So tell me, how old was he when he first got ill?
He was about 15 when he first became ill, but I didn't know anything about mental health at that time. I wasn't a social worker. I was just a mum. And I misinterpreted a lot of what was happening to him as sort of teenage angst, and lots of his friends were experiencing similar things. And he was actually just tipped over into 18, so therefore into adult services, when he first was seen by a doctor. And because he was over 18, as his parent, I was excluded. Everything then revolved around him going to appointments and things on his own.
And did he get a diagnosis at that point? Or was he given medication?
No, he didn't get a diagnosis for 8 years. So, and 8 years is a long time to be in quite acute mental distress some of the time without any help or support. So he obviously found ways of managing that, many of which are not very socially acceptable. And at the time I found that really difficult. But
he used drugs and alcohol to try and manage that. Yeah.
But as I've kind of learnt more and reflected on it, I realised that really he was just doing the best he could to manage acute mental distress, and his moods, which would swing wildly between sort of deep depressions where he wouldn't get out of bed or wash or eat for weeks, to sort of horrible mixed states where his mind would be racing fast but full of nasty, unsafe, dangerous thoughts that were frightening, or being really elevated but feeling invincible and wonderful and doing all sorts of daft things, whichever really came into his head at the time and seemed like a good idea, because he was in a manic state.
Now, one thing that you bring out very powerfully in the book is that this trap that Tim fell into, where he was too ill to access community services. You talk about how he would fail to make an appointment, perhaps, because, as you say, his life was chaotic, and he would then lose his place in a community scheme to help with drugs and alcohol. But yet he wasn't ill enough to be detained and assessed for treatment. How common is that?
I describe it as not being the right kind of ill. Services are designed around services. They're not designed around people who are not, as a term would say, wanting to engage, willing to engage, motivated to change. They're certainly not designed for people who are frightened of services. And Tim was very frightened because of his paranoia about what would happen if medical professionals saw him when he was unwell. And I think it's really common. And after Tim died, I looked at some research and discovered that where Tim lived, for young men of his age, the morbidity rate was the highest. And actually, people like Tim who had a dual diagnosis of bipolar and drug and alcohol use are at the highest risk of dying, and yet they seem to be the ones that are most elusive within services, either because they are frightened or chaotic, or I think, frankly, because services haven't got the resources to offer the ongoing relational care that they need. Because everything's designed around this sort of episodic, you go in, you're assessed, and you're signposted out. And that happened frequently to Tim. At the times he wanted to have help, he would ask for help, but it would take so many months before he got to an appointment, by which time he was either too unwell and wouldn't go near them, or had recovered somewhat. And they would say, well, there's nothing much wrong with you, off you go. And I think one of the things that shocked me after he died is when I finally got hold of his files, is just how thin they were, just how little in 15 years for someone who'd been chronically unwell he'd been seen. And I don't think he's unusual. And I think that's the thing, that at the time I thought it was unusual. At the time I thought we were spectacularly unlucky, and that what happened to Tim was unusual. But over the last 6 years, I've come to understand that there are many, many people like Tim.
And many lessons to be learned. Would you share with us, and I know that there is a reason for asking you to do this, how you heard about his death?
Yes. Well, in the book, there's messages for people across health and social care, and that actually includes the police. So when I heard about Tim, it was 6 a.m. in the morning, and I wasn't dressed. I put on my husband's dressing gown, went to answer the door, and a young policeman, and I do understand the difficulties the police are under and the trauma they face. He wouldn't come in. He wanted to tell me on the doorstep, and I had to ask him to wait while I got my husband, and to ask him if I could get dressed. I was sort of saying, please just let me get dressed before you carry on saying what you're saying. And then when we had to sort of almost force him, and my husband had to almost force him to come into the lounge, and he managed to squeeze himself behind me on the sofa, but between me and the wall, and he sort of addressed the back of my head. And then he was in and out and gone. And then I realised he hadn't even asked about Tim's father, and whether he was being informed. And so that was the most hideous way to find out. But sort of contrasting that, the police sergeant who did the investigation was really kind. And I kind of challenged him and said, look, the way I was told was just appalling. And I was left to tell Tim's father. All this young policeman said was, will you tell him? Yes.
I know you also went through a really difficult process at the inquest 6 months later as well. I'm just reading the book. I'm not sure that if you didn't have the kind of skill set that you have as a social worker, and obviously a lot of tenacity, I don't know how you would have ever coped with that, because it seemed again that it was a very difficult situation where the notes that you were given were all out of order, and really there wasn't a lot of information there.
No, I think that was really shocking. So as a social worker, I assumed when someone died that any and every investigation would be thorough. The worst had happened. This is something serious. So the whole process I found opaque, confusing, and yet I'd got these professional skills. So we waited 5 months for the paperwork for the inquest. And when it came, it was just a chaotic bundle, and there were bits missing and incorrect information. So I kind of put my professional head on and put it into a chronology and looked for the gaps and asked questions. And then I discovered that the process is that if you ask questions and you don't have legal representation, and most families don't because there's no funding, and I certainly didn't, then you, the family member, are expected to cross-examine anybody you call. So those gaps, if I'd have called the mental health trust, the GP, the police, me at the very first inquest I'd have gone to, which is actually about my son and I'm in bits, I would have been expected to ask those questions, but they would have all been lawyered up with their barristers and solicitors, and they're all used to going to these events.
Caroline, I know that you, in your book, talk about a lot of recommendations and changes you would like to see. Could you just give us today perhaps your top one, if there's one thing that you could say to people out there in the professions who might be coming across somebody else like Tim?
I think it's about kindness, empathy, compassion. Look, if one thing, there's all sorts of practical things. There's free things, there's things that cost money that could be done for people who are unwell, for the bereaved. But actually, if we started acting with decency and compassion and treating people as our fellow human beings and kindness, that would go a massively long way.
Well, Caroline Aldridge, the book is called He Died Waiting. Thank you so much for sharing your story with us today. Thank you. I can tell you that we've got a huge response to this story. One here says, it's a brilliant conversation about mental health services on Woman's Hour, and also pointing out that people with eating disorders can also relate to not being the right type of ill. Another here says, thank you so much for sharing your son's story on Woman's Hour. We're thinking of Tim and all the other Tims out there. 8 years is too long to wait for the help that he should have had. We're getting a lot of responses to that story. So Caroline, thank you so much for sharing it with us.